Hey gang, welcome to another episode of Rotator Cuff Expert. Again, my name is Dr. Orcutt, and my job is to try to break down the complex world of shoulder pain, shoulder surgery, shoulder recovery, and try to make it easier to understand and easier to get through. Please subscribe to the channel, and please use the little alarm to know when we have another video. This is actually a little bit different video for me. I'm interested. We'll see how people like it. Let me know if you like it or don't like it. This is actually is a little bit a change in how to treat shoulder pain, how to treat impingement specifically. So we talk about impingement, right? We have this ball, we have the socket. Above the socket, we have this bone called the acromion, right? And the acromion often will have a little hook or a little bend to it. It can have a big hook or a little hook. And as you can imagine, if you have a little hook and you do this over and over and over, we're concerned that perhaps that's part of one of the ways you have a rotator cuff tear. Obviously, we know rotator cuff tear can occur traumatically. Probably most rotator cuff tears are not traumatic, but are degenerative tears. You can have a combination, right, of a tear that's getting weaker and weaker and weaker, or a rotator cuff that's getting weaker and weaker, and then you have a trauma and you have a rotator cuff tear. That's probably why people who are in their 20s don't have a traumatic rotator cuff tear. They're more likely to break their bone than they are to have a traumatic rotator cuff tear, because their tendon is stronger than the bone. But as we get older, our tendon gets weaker, our bone is not very strong either, but relatively the bone is stronger than the tendon, and we get this, again, this wear over and over again, and then we have a trauma, and then the rotator cuff tears. This impingement theory, right, the theory of this bone and that pinch over and over and over, there's an orthopedic surgeon. Actually, I had never heard of this until a few months ago, when I'm just kind of looking for information to share, looking for information that's interesting. Dr. Kirsch is, again, an orthopedic surgeon, been doing it for a long, long time. Now, I don't know if he's still practicing or not. I don't know. I didn't look that up, but has a book, Shoulder Pain, The Solution and Prevention. And this was the last edition was in 2013. So that means there was the fifth edition. So he had several editions before that. So I can imagine it's only probably in the 2000s, probably when he had his first book. Again, I don't know. I can only find the 13th edition, or the 5th edition, which is in 2013. So interestingly enough, he talks about hanging, right? And I actually, throughout my whole education, which says maybe something about my education, I don't know. Through my whole education, never even heard of this concept. Now, I've heard of what's called Wolff's Law. Wolff's Law has to do with the ability to bend bone, which is you can over time, right? If you put enough force, and this is actually his theory, if we have this bent acromion, let me do it this way. If we have this bent acromion and we hang, which hang means we rotate up, and we're hanging like this, and if we rotate up our shoulder, we are actually pushing in that acromion. So if it's bent, what we're doing is we're pushing it up, and over time, if we do this for long enough, over a long enough period of time, it is theoretically possible that we get that curve. Now, what's also important is that actually it's not just bone. There's actually another ligament that comes down here, the coracoacromial ligament, that actually thickens too. And I actually think thickening and calcification of that ligament actually causes some of the bend too. So that ligament and the acromion here, if you do hangs, potentially you can straighten out that acromion. And if you can straighten out the acromion, you have less impingement. If you have less impingement, theoretically, you could have less risk of rotator cuff tear, or if nothing else, decreased pain. And there's a whole bunch of testimonials within his book. Again, I'm not necessarily recommending his book. I just think it's really interesting and fascinating that this is a concept that I've never even heard of. This is what I do. I think you have to be careful, obviously, if you have a torn rotator cuff, hanging with a torn rotator cuff is not going to heal the rotator cuff tear. So it's important to know where you're at. If you have rotator cuff irritation or rotator cuff impingement, perhaps it will. Obviously, you have to be careful when you hang. Depending on how heavy you are and how strong you are, you may not be able to hang. There's little grips, like if you were going to do pull-ups, this is the beginning of the pull-up. Before you pull up, you just hang, right? You have little grippers, and you can hang on the bar. And there's also all sorts of contraptions you can put on your doorway for a pull-up, so you can do for hang. So I think it's interesting. No, I'm not recommending it, but I think it's an interesting concept, interesting idea of Wolff's Law, straighten it out, an interesting that there's more than one way to fix things. And very interesting, most interesting, that came from an orthopedic surgeon, right? Not coming from somewhere where you'd expect it, like a chiropractor or like a physical therapist. So interesting. I thought you might be interested in it. Again, it's Kirsch, Kirsh, and it's Shoulder Pain, the Solution and Prevention 5th edition. So, check it out if you want to. If not, that's okay too. Give me a thought of whether this is helpful or not. Because again, some of these things that I bring are kind of on the edge of medicine and just real life. And I think that's important to be able to tell you what a surgery is and what a surgery does, but also tell you other things that are kind of alternative. So anyway, thanks again. And again, like the channel, subscribe to the channel, ring the bell, and we'll see you next time. Thanks.